My name is Chris Cole. I'm a third-year student in the Kinesiology and Education Combined program here at the U of S. And this is my Kin 321 first assignment, exposure to sport medicine. As a fun fact about myself is that I actually broke my elbow when I was in 8th grade, and I had to get pins and screws put in that, so that required surgery, so that took a long time. Going into it, some safety considerations I look at beforehand. Make sure all participants go through the pre-participation screening, make sure they're eligible for play, make sure everyone has proper equipment, and so they're safe to play. If they have any injuries that may need extra equipment. Those are for the players. For myself, I'd want to have a tape and sling on me because we know volleyball is big in injuries for like shoulders and hands and legs, that sort of thing. And just be careful about the court environment. A lot of volleyball injuries are landing, so watch out for other people's feet or even balls that could be in the way. Going into my emergency action plan here. So if I was in the scenario of the video and watch this volleyball player get hurt, I'd first look at this is an acute injury, I'm pretty sure, and not a chronic injury. It's also urgent and not emergent. You don't really have to necessarily call the paramedics yet. If you're able to, I would say go right outside the PAC gym doors to the equipment desk there, and I've seen they have wheelchairs there in my other classes, so if you could take a wheelchair and try and wheel the person out of the gym through the front doors and to the elevators that's right outside the front doors into the PAC gym there. That would probably be my best way to exit them out of the gym if you were able to without paramedic use. Assigning first responder roles, I would be the charge person. The call person, I would make a family member or a teammate, someone that knows the person closely, that's to the scene quickly. They're in charge of calling EMS if needed or giving the person a ride to the hospital. And the control person would be a coach, controlling the crowd and making sure that they're able to get out of the building safely without any crowd getting in the way. Mechanism of injury that I saw within the video, I noticed force overload during landing in the lateral direction on her jump. As she was jumping outside, she really overloaded on that left leg and put a little bit too much on it as she landed, maybe. So that's combined loading with tension and torsion put on the leg at once. The hypothetical injury I think she may have experienced, the way she grabbed her leg when she hit the floor and felt it for a second, I was guessing a hamstring injury when she was grabbing the back of her leg, so a possible hamstring strain or a sprain, if even worse. Hopefully not a tear or anything serious, but if it's more serious, it could be a possible tear to ligaments in there, so a possible ACL, MCL, or PCL rupture or tear in that, which would require surgery. Imagining the scene, do my primary survey, make sure she is conscious, which she was. I'd try and stabilize the leg, ask for a history if she's injured it before, observe and palpate the leg, and test the range of motion if she's able to. Estimated timeline, if surgery is needed for this, an ACL or something like that, that's 9 to 12 months. A non-surgical ACL is 3 to 6 months. Just a muscle injury is 2 weeks to a few months, depending on the situation. I'd refer to minor emergency or walk-in clinic and probably a physiotherapist. And for future strategies, I'd stabilize the injured area and strengthen it a lot, work on the jumping technique being used, and wear a knee brace during the gameplay. And that's it. Thank you.